Hello people, I am Azharuddin Ahmed from group number 485. Today I will do a procedure which is also known as lumbar puncture or spinal tap. So basically it is done to obtain CSF uh, from the patient to diagnose many kind of diseases, as for example any bacterial disease, any viral disease, or to obtain it for the check how is the pressure in the CSF ventricles. As for example in sepsis, the CSF opening pressure are so much. So what are the requirements or what are the tools required for this lumbar puncture? So basically we need a CSF collecting tube to which we will keep that CSF for investigation, and we need an injection basically to apply an anesthesia to the lumbar area, and we need a memometer to detect the opening pressure of CSF, and the CSF obtaining needle which will penetrate through the lumbar region into the patient spine, and will obtain the CSF. So here will be my patient. So I have my patient which he have to go undergo a CSF investigation for meningitis like symptoms he is having. So first of all I will have a consent form from his parents, so that there will be no problem from the parental authority. So I will ask the patient to first of all you need to know about the position of the patient. The first position is that I will ask the patient to lean forward, so that the space between the lumbar disc increases, so that we can easily penetrate the needle and obtain the CSF easily. Basically the CSF is carried out in lumbar region, in the lumbar fourth and fifth, between the lumbar fourth and fifth, and I'll ask the patient to lean more down to increase the space between them, between the lumbar, and I will penetrate the CSF needle throughout through the space between 4 and 5, lumbar 4 and 5. Yeah, as I will penetrate the needle, and then the CSF drop will come out. Okay, so as I have now entered the CSF needle into the CSF canal in the spinal cord, so now I can check the CSF pressure by this CSF memometer for knowing any other kind of diseases. As for example, in sepsis, the CSF opening pressure is so high. So I will collect the CSF drop in a CSF collecting tube, and I will send it for to laboratory for further investigation. And through this CSF needle which is penetrated into the vertebral column, we can easily give any medication for any further treatment procedure also. So all the procedures are you know, so this is all about lumbar puncture. Now I will apply a bandage into the area through which the lumbar puncture is done, and I will ask the patient to lay down for 30 to 40 minutes, and in further if there is any pain the complaint by the patient, I will give him simple acetaminophen or paracetamol for pain relief. So the procedures are all completed, and I ask the patient to take some rest. So I ask the patient to sleep in reverse sleeping position. So he will take rest now. Thank you.